Assalamu alaikum. Good evening, everyone. I am Dr. Tariq, family physician from Dhaman Center. On behalf of Dhaman Center, today we will talk about coronavirus, COVID-19. There have been already two sessions on this topic in two different languages by our previous physicians from Dhaman Center in two different languages, Hindi and Malayalam. You can watch these sessions on Dhaman Live YouTube channel. At the end of today's session, after my talk, there will be a question answer session where you can ask me questions and I will try my best to answer your questions, inshallah. So let us come to our topic today, which is COVID-19. COVID-19 is a viral respiratory disease which belongs to a group of coronavirus. Now you will ask, what is coronavirus? Coronavirus is a family of viruses which can cause illness in animals and humans, ranging from a common cold to more severe diseases like SARS and MERS. You might be knowing that there was an outbreak in 2002, which was an outbreak by the coronavirus, and it was named as severe acute respiratory syndrome. This virus originated from a wild cat and transmitted to the humans. Then again in 2012, there was one more outbreak of coronavirus. It was named MERS, Middle East Respiratory Syndrome, because this disease was found in Middle East and was mostly affecting camels, and it was also named as camel flu. It originated from the camels and transmitted to the humans, and its second name was given as camel flu. So COVID-19, it is also named as novel coronavirus. That means a new coronavirus. These two, MERS and SARS, were the old known coronaviruses. And this COVID-19, it is also known as a novel coronavirus. That means a new coronavirus. Okay, novel means in English, it is a new coronavirus. It was not known, so it was which was not previously been identified in humans. Well, coronavirus, this COVID-19 was first found in the city of China named Wuhan. It was found originated in the seafood market, where it originated from animal source and transmitted to the humans. And since then, there is a transfer from human to human. Firstly, in China, there were a lot of cases in China which were diagnosed as pneumonia. And then scientists and doctors worked and later come to the conclusion that this pneumonia is caused by a virus which belongs to the family of coronaviruses. And it was named then as novel coronavirus, and also WHO gave it the name as COVID-19. This COVID-19 is now spreading from China to all over the world. It has been labeled as pandemic. Pandemic means when a disease spreads all over the world. As for now, it has spread in almost all the countries, 181 countries in the world. And as for now, to my knowledge, there are around 1.7 million people infected with this COVID-19. And around 100,000 people have died so far. It is spreading very fast. So, what are the symptoms of COVID-19? Now, of course, you will be thinking about the symptoms, so I will put some light on the symptoms. Actually, the main symptoms of COVID-19 are, it is fever, high-grade fever, dry cough, shortness of breath, and severe body aches. These are the main four symptoms, but there can be other symptoms like it can be throat pain, it can be with fever and cough and diarrhea, it can be with other symptoms also, but the main four symptoms are fever, cough, shortness of breath, and severe body aches. These are the main symptoms. So, who can get this coronavirus? Actually, this coronavirus spreads from human to human. So, everybody is at risk of getting this virus. Once this virus enters into the body of human through air droplet, droplet, it within 2 to 14 days, that means it is known as incubation period. It is a period when the virus enters your body and affects and replicates there, multiplies, and in an average of 5 to 6 days, a patient can show the symptoms of fever, can show cough, body aches. It can be mild, moderate, and severe. In the mild form, maybe patient has simple like low grade fever or simple cough, and he may recover within 1 2 weeks as simple flu, and he doesn't need any hospitalization or any sort of supportive care. But in some patients it can show moderate and severe diseases, and the people mostly who get the severe form of the diseases are those who have low immunity. Low immunity means people who are vulnerable, who are at high risk. Low immunity people means those people who are suffering from a respiratory disease, chronic respiratory disease, like chronic obstructive pulmonary diseases, like uncontrolled asthma, like people who have recession of lungs, like people who are on oxygen therapy, people who are suffering from cardiovascular diseases, hypertension, diabetes, or patients who have different forms of cancers like lung cancer, other forms of cancers, who are receiving chemotherapy, who are receiving radiotherapy, who are receiving other immunosuppressants. And in those people, it is very dangerous and it can take the severe form of the disease. So those people who are suffering from disease have to take more care than those people who are healthy, who are young. But disease, it has been seen that disease can spread from one person to another person to all healthy people, even children. But so far, the children have less affected, but it is spreading very fast. So it has been seen also recently that even a person can be affected by coronavirus and without showing any symptoms like fever, like cough, or body aches or anything. He can be totally asymptomatic. That means he has no symptoms at all, but he has the virus inside his body. As I said that this virus enters the body and takes approximately 5 days, but from 2 days to 14 days, it can stay inside the body and show the symptoms. And a person can get cured also and without knowing that he had a coronavirus. So I told you who is at the risk and people, as I said, that what are the symptoms and who is there. And now I will talk about how it spreads. Coronavirus spreads by air droplet infection, mostly from the nose, mouth, and eyes. Now you will ask, what is air droplet? Air droplet means if a person is infected by coronavirus, he or she, the person, if he coughs, sneezes, or exhales, or talks loud, by exhaling or by sneezing, by coughing, the air droplets from his mouth, they come out and can reach up to 2 meters and settle on the surfaces around him, like table, chairs, furniture, paper, anything. Okay? So these air droplets, the bigger air droplets, they quickly fall on the surface. And the small air droplets, which are not visible for our eyes, but big droplets we can see. When a person sneezes, we can see some drops coming, fluid drops coming out. But some of them, which are very small, which are not visible by the naked eye, we cannot see them, they can sustain in the air for some time, even from minutes to hours. And what will happen? How it will get transmitted to the other person? Once the virus is on the surfaces, the other person comes and sits on the table and touches the table. Okay, and his hand gets contaminated with the viruses. There are hundreds and thousands of viruses which are not visible, and his hands gets contaminated. And one unintentionally or intentionally, he moves his hand towards his mouth, toward nose, towards eyes, and the virus starts to getting in his body, to his lungs, and starts replication, starts multiplication, and within 2 to 14 days, this person can get sick from this disease. So the spread is mainly by hands. So spread is mainly by the source is mostly hands, and we can get it from also from air droplets. If a person sneezes and you are in surrounding of this person in between like 2 meters, you can get directly it from inhaling this air, where these air particles are sustained in the air. Once you breathe this air, you can get this virus inside your body without touching any surfaces, without moving your hands towards your nose, mouth, or eyes. So this is how this virus spreads. So now we will ask, what is the treatment of COVID-19? Unfortunately, it is a viral infection. Until now, there is no treatment of this virus. Antibiotics are there, but they are not useful. It is not a bacterial disease. And we have many antiviral drugs, but they won't work in this COVID-19. Scientists and doctors all over the world are trying their best to find the treatment and to find the vaccine for this COVID-19. But it might take some time. So as we know that how we can protect ourselves, what measures can be taken to stop or to decrease the spread of this COVID-19. Very simple measures can be taken to stop the spread of this COVID-19. As we know that it's spreading very fast. So we have to do something together, collectively. It is our social responsibility to work together, to do together something so that we can save ourselves, our families, and our friends and our nation. Well, as you know that in Kuwait, government, Ministry of Health and other authorities are doing their best. They are doing their best and they are working day and night to stop the spread of this coronavirus, to minimize the spread of this coronavirus. They have put a partial curfew, social distancing, regular hand washing, wearing of masks when you go to the grocery, when you go outside. And again, government is instructing us to stay home. And we shall obey with these orders. Believe me that if we obey these orders, we will help ourselves and our families by stopping these diseases. Protective measures, what we can, regularly and thoroughly clean our hands. As I said before that the main source is the hands. So regularly washing and cleaning your hands with the alcohol-based hand rub or with a simple soap and water for at least 20 seconds. How you can wash your hands? There is a special technique. It's not difficult. It's very easy. Just rub on this surface on the back side, front side, then with nails, nail beds, then thumbs. And for this, there will be a separate session from our infectious department of Dhaman, which will demonstrate how to properly wash your hands and how to properly wear the mask and remove the mask. Because I have seen many people wearing the masks improperly, putting the mask and removing it with their hands, putting on the throat, putting on their foreheads. It's very wrong. If you use the mask, please use it properly and dispose it properly. Maintain at least, as I said, that this virus with the sneezing or coughing or even talking loudly, this virus can reach up to the distance of 2 meters. So again, government is instructing us, authorities of Kuwait are instructing us to keep social distancing. What does this mean? Again, it comes to the virus so that it doesn't spread. So maintain at least 2 meters of distance between yourself and others. When you go outside, when you are standing in a queue, when you are standing outside the grocery store, or either it is your or office or meeting or any, stay away at least 2 meters away from other person, because you don't know whether this person is infected. As I said, that this disease can be in a person even he is asymptomatic, even he doesn't show any symptoms like fever, cough, he can be normal, but he may be infected. While he may sneeze or he may talk loudly and virus comes out and you can get the virus. Avoid touching your eyes every time. Please avoid touching your hands, nose, and eyes. It is very difficult, but we can do it because unintentionally sometimes we use our hands to move our masks even, which is wrong. We should not move our masks up and down because our hands gets contaminated. When we touch the outside of the mask, what will happen? Our hands get contaminated and we touch the nose and the virus directly invades inside our body. Then one more point, follow the respiratory hygiene. What does this mean? This means that covering your nose with either a tissue paper when you sneeze or cough, either with a tissue paper or a flexed elbow, your flexed elbow. What will happen when you sneeze or cough? The particles, air particles, these what we call it, airborne particles, which will come from your mouth, they will be stuck to your clothes here. They will not spread around. Also, when you use a tissue, when you cough or sneeze, after closing your nose with the tissue, close the tissue and throw it in the dustbin proper. Don't throw the tissues around. Don't throw the used things around. And wash your hands immediately. If any one of us, among us, having these symptoms like sneezing, cough, fever, body aches, or shortness of breath, please call your doctor or call 151 in Kuwait. We have a service 151 in Kuwait. They can explain you, they can assist you what to do further, whether to go for testing or not. One more thing, fourth point is to stay home. Again and again, stay home. If we stay home, we have a very less chance of getting contacted with those people who are infected. We have a very less chance if we stay home. So better, I advise everyone to stay home and go out only in case you need something very urgent. It is very urgent. But otherwise, unnecessarily going out is putting yourself, your family, your neighbors, your friends, your nation on the risk. So this was the basic information regarding COVID-19. I hope that everybody could understand what is COVID-19, what is this coronavirus, and it is a new virus. Still, studies are going on, and all the world, around the world, scientists and doctors are working on it, and they are trying to understand it well. And hopefully, very soon, there will be some symptoms, there will be some treatments available. And I hope, inshallah, we will try our best to follow the protective measures laid by Ministry of Health and other authorities of Kuwait. Well, as I said that there will be a question and answer session at the end, so it will be my pleasure to answer a few questions. And I will look on the questions and I will try to answer these questions. Well, there is a question from Mr. Suresh. He is asking that these are symptoms for all virus infections. Any separate COVID symptom? Very good question. Well, as I said, yes, it is true that these symptoms like dry cough, fever, body aches, these are symptoms of influenza, flu, and other viral infections. But as I said that it can be in the mild form, moderate form, and severe form. So in mild form, it may show only little bit symptoms and it may go off of its own without showing severe symptoms. But in moderate and severe form, patient will be having shortness of breath and dry cough. Shortness of breath, dry cough with high-grade fever. This is most probably you should go for having a check for COVID-19, having a test. Fever, high-grade fever, dry cough, and shortness of breath, and severe body aches. Because in other flu infections, we have usually running nose and throat pain without any cough, without any travel history, or without any history of contact with other persons. So there are no specific symptoms. These only which I mentioned, three specific symptoms: high-grade fever, dry cough, and shortness of breath. Yeah, Mr. Iqbal has asked a question. Is it possible to get corona without having fever symptoms? It is not okay. I think to get corona without having fever symptoms. Yes, dear. As I said in the beginning, Mr. Iqbal, I will answer your question. As in the beginning, I said that this corona has been now seen in those people who have no symptoms at all, who don't have fever, who don't have cough, who don't have any symptoms, but they have turned to be positive. So, if a person is positive but you don't know, he don't have any fever, and he works with you, or you gather with him, or you sit with him together, either it is an office, either it is a shop, either it is a mall, or either it is anywhere, there is a chance that you will get infected from him if he coughs, sneezes, or you get in close contact with him. So be careful. That's why these measures have been put on by the government here in Kuwait, like partial lockdown, don't go away, stay home. These are the measures we can stop getting this virus. Mr. Javed Sanjay, how to self-check if no symptoms? Okay, well, there is no like self-check at home where you can find yourself that you have anybody is suffering from corona or not. So actually, if you have no symptoms, be happy and try to be at home, be safe, don't go outside unnecessarily, and stay safe at home if you have no symptoms. But in case if anyone having cough, fever, shortness of breath, or any other symptoms, as I said, they should call 151 or call to their doctor and check for the medical care. Mr. Rohit Varghese, okay, in the centralized AC building, if there are any possibilities, okay, centralized AC building, is there any possibilities for virus to transmit through ducts, ventilation between rooms? Dear Rohit, good question actually, but so far, as I told you that it is an air droplet infection, that means which travels through the medium of air droplets. So far it has not been found anywhere that it is transmitted through the air. Air conditioning works, passes through long tubes through the air. Droplets cannot, a person if sneezes, it cannot go through so long, through these droplets cannot travel so long. So there is no chance, till now it has not been proved anywhere, it has not been found anywhere in the world, and there is no chance to get the virus through air, because WHO again says that it is not an airborne, it is an air droplet infection, not the airborne. If it would have been an airborne infection, yes, there would have been possibility through getting the infection through centralized ACs. So it is a good news for us that it is not an airborne infection, it is an air droplet infection. I hope that this answer satisfied you. Ms. Navi Khan, how corona positive patients getting recovered? Please let us your briefing. Okay, if a patient is positive from corona, how he gets recovered? Okay, as I said that in coronavirus, it can have mild, moderate, or severe form of disease. In mild form of diseases, if a patient is positive and he has a mild form of disease, like simple, very small cough, low-grade fever, simple body aches as a simple influenza or flu, this person will get cured of its own without, if his immunity is very good, if he is a normal, healthy adult, without any complication, without any chronic disease or anything, most probably he will be having a mild form of disease and he will get cured without any hospitalization. He can get cured by simple taking hot fluids, as in normal flu we are using as plenty of fluids, being at rest, avoiding contact with others, and he can get cured within a couple of weeks or even 10 days as normal flu infection. But those people who have the moderate or severe form of disease, they might need to go to the hospital and need supportive care in the form of oxygen, in the form of intensive care, especially those patients who are old, more than 60 years of age. They need hospitalization. And also, I said, mentioned in the beginning, those people who have chronic disease, they can get the severe form of diseases, and they can also get well. It's not guaranteed that they will not get, they can also get well by supportive measures, oxygen, and it is not necessary that everybody can get the severe form of disease. And again, if we see the statistics till now, around 80% of the infected people are getting only mild form of disease, and only 20% of the people are getting the moderate and severe form of the disease. Mr. Athar Kudus, in summer, virus infection can get reduced. Well, actually, this virus has nothing to do with cold or hot. This virus survives inside our body, and when we exhale it, it goes out on the surfaces. It can sustain on the surface for some time. It depends upon the surface, and it has not been seen that it is like killed by cold or it is killed by hot. So till now, there is no evidence that the virus spread will be reduced in the summer. It will be reduced by cold or anything. Mr. Gayatri Pillai, how to confirm every morning that I am fine? Is there any self-check? Well, dear, if you are at home, if you have no symptoms, just stay home. Don't go outside. Don't put yourself in the risk. Don't put your family in the risk. If you are staying at home and you are healthy, you are taking, like, as usual, your regular exercises. If you are a smoker, I will advise to quit smoking, because it has been seen that it affects the lungs. It is a basically respiratory disease. So if you are a smoker, quit smoking. Try to quit smoking and follow a healthy lifestyle, which is regular exercise, eat well, drink plenty of water, drink plenty of fluids, which so there is no need to be panic, and self-check every morning yourself. So just relax. And as a doctor, I don't self-check myself every day. Okay, so I follow healthy lifestyle, like do exercise half an hour at home, which is enough, and drink plenty of fluids, normal food, that's all. And don't go to the places where there is a risk. For example, places where there are people, where there is a crowd of people, or to grocery shops. And always take precautions, like if you go out, if there is a necessity to go out, please wear the mask if you have surgical mask, and wear the gloves, disposable gloves. And once you come back, remove these gloves, put them properly in the dustbin, and wash your hands nicely, and then remove your mask, put it in the dustbin, and again wash your hands with the sanitizer for 20 seconds. And regularly washing your hands, and regularly washing them with even soap and water, guarantees you that you will have a minimal chance of getting this virus, because hands are the main source of getting this viral infection, because our hands gets contaminated, and by unintentionally a person cannot hold his hands 12 hours, 24 hours like this. So unintentionally sometimes we take our hands and touch our eyes or nose or mouth. Well, there is a question from Mr. Narayan VR. Any immunity boosting vitamin preventive medication suggested? There are a lot of, on WhatsApp, on social media, a lot of people are talking about these immune boosters and some other newses. But please, I will advise not to take any immune boosters. Just as I said, follow a healthy lifestyle. Just drink and eat as you are eating as usual. You can take, lemons, which is a good source. We doctors advise all the time to take vitamin C, which is a good source to prevent the viral infections, common viral infections. I'm not talking about COVID-19, other viral infections, which like tea, lemon tea, and regular exercise, which is more than enough to boost your immunity. So I don't recommend to take any specific treatment because it is not approved by any WHO or any authorities, any scientists or doctors have not said that we should take these specific immune boosters or anything. Mr. Javed, using drinkable hot water is effective? Actually, it is not effective like to kill the virus. Like if you say that it is effective to kill the virus or anything, there is nothing like that. Even I have heard in social media, people are telling that the virus is killed by the alcohol, sanitizers and all that. So drinking alcohol is also good, but this is wrong. There is no information like that. And drinking like hot tea as usual, okay, it's okay. So that to prevent yourself from getting any kind of cold, not COVID-19, any kind of cold or flu. So drinking hot water is not like effective to cure this COVID-19 or to prevent yourself if you are infected from other person to prevent. Yes, washing your hands regularly, wearing a mask, taking precautions, staying home, don't keeping yourself away from other people who are sick or meetings or any other things. These are the best ways to prevent yourself for getting this disease. There is a question from Mr. Yes, Mr. Vinay Raj, I am listening, please. Yeah, Mr. Vinay Raj is typing the question. Well, yeah. Vinay Raj is typing the question, and I will try to answer his question. Okay, until he types his question, I would like to again stress on few points, which I already discussed with you. Regularly washing and your hands thoroughly with alcohol-based hand rub or soap. So when you use the alcohol-based hand rub or any hand rub which is alcohol-based, when you put on your hands, you just rub it up to down, and then you can use on back of your hands. You can use on both sides of the hands. Then your nail beds, you can use it on like this motions. It's very simple. Then your nails, your thumbs, and at the end your elbows. This is the right way to use your hand sanitizer or hand washing with the soap at least for 20 seconds, which eliminates the virus from our hands. Mr. Vinay Raj has put a question: what precautions can do at starting time itself to prevent as more affecting the body? What precautions can we do starting time itself to prevent as more affecting the body? So as I said that these are the same precautions we can take to prevent ourselves. Like as I said that if your immune system, if your immunity is okay with your body, if you are not suffering from any chronic diseases, if you are a healthy gentleman and healthy adult, if you are smoking, I will advise to quit smoking. If you are not taking exercise, I will advise to have a regular exercise at home for at least 30 minutes. You can do yoga, you can do any exercise. If you have a treadmill, you can walk on it. You can have regular fruits, vegetables, which will increase your immunity. You can have hot drinks like tea, coffee, tea with lemon. These are the things. These are the simple measures which increase your immunity and prevent you from any kind of flu. And also the main important thing, hand washing, which I again and again will say, hand washing. regularly. And when you touch your lift buttons, when you touch any surface, when you touch the door handles, either you go to the market for buying groceries or all that, we touch the trolleys, we touch the handles, which are the main source of infection. When we touch them, please use the gloves. If you don't use the gloves, better use them. If you don't have, wash your hands regularly with hand sanitizer and soap. These are the main preventive features which can prevent to spread of the infection. And if you see anybody like coughing, stay away from them. And if god forbid anyone among us has symptoms or anything like that, high grade fever, cough, or shortness of breath, we should call our doctor and ask for the opinion whether to go for testing. Or and there is a number, as I mentioned before, it is 151. We can call them and they can advise us properly what steps to take further. Well, Mr. Iqbal Malaya, how long does the virus survive on surfaces? Yeah, I think I mentioned in my talk before that it has been seen that this COVID-19 coronavirus, once a person who is infected, once he sneezes or coughs, especially they have the dry cough, those people who are infected, once they cough out, and with their cough, small air particles come and they settle on the surface. And if it is a surface like table or paper or surrounding chairs or handles, or it can survive on these surfaces from several hours to days. Still research is going on. Till now, what I know to my knowledge, that it can survive from several hours to several days, depending upon the surface, whether it is a plastic, it is wood, whether it is paper, and it is humid. If it is a humid, like if a room is humid, the virus will survive on the surfaces for more, because as we know that the virus is transmitted through air droplets, so it needs some form of moisture. So it can remain on surfaces for a long time. So that's why again and again, if you touch any surface, like a button of the lift, like the door of your handle of your door, sorry, handle of your door, or touch the button anywhere, just make sure that you wash your hands again and again, again and again. You can wash your hands many times a day, and it will not harm you, but in fact, in turn, it will prevent you for getting the infection. Mr. Shibu Thomas, are some people more at risk than others? Very good question. Yes, I think I mentioned in my talk. Okay, I will repeat it again. Yeah, there are people who are at more risk to get this infection. These are the people older than 60 years of age, people with chronic diseases, respiratory diseases like chronic obstructive pulmonary diseases, people with uncontrolled asthma, people using oxygen therapy, people who have diabetes, people who have hypertension, people who have coronary artery disease, and those who are suffering from cancers of the lungs, cancers of other organs, who are receiving chemotherapy and radiotherapy. Because we know these people are already weaker than the normal people. And those people who are receiving chemotherapies, radiotherapies, their immunity is low, their immunity gets less. So these people are more vulnerable, more at risk to get these diseases. So it is advisable for those people to stay safe, to stay home, don't move outside. And also for those people who have lung resections, because it is mostly affecting your lungs. This is COVID-19 is an acute respiratory disease. So it is affecting the lungs most, causing the pneumonia and then causing the complications. So those people which I mentioned are at more risk of getting the severe form of disease. And mostly the young people, they can get the mild form of disease, but it's not guaranteed that everyone can get the mild form of disease. It depends upon person to person. It depends upon maybe genetics. It depends. Still, researchers are doing the research on that how this disease behaves and how it will behave further. As for now, we know that it is spreading very fast. It is spreading in all over. It has spread in all over the world. It is known as pandemic now. It has spread everywhere and it's spreading very fast. Mr. Basil has asked a question here. Is there any study showing results in using medicines like hydrochloroquine to treat COVID? Even though WHO denies any use, still many countries looking for this medicine. Well, good question. Yeah, there has been a debate recently on this, Mr. Basil, that hydrochloroquine has been proven effective in treating COVID-19 or preventing the COVID-19. But I'm sorry to say that till now, there is no recommendation from any reliable source like WHO, CDC, or FDA that this drug can be used to treat or to prevent COVID-19. And also, I will mention again that hydrochloroquine is not a simple drug, it's not a paracetamol, it has a lot of side effects. So, before giving hydrochloroquine or before using hydrochloroquine, I will advise everyone do not use it of your own, do not take it so easy to take it as a preventive medication. Always consult your doctor and wait for the higher authorities, wait for the decisions from WHO and FDA, CDC, which will give us information. They are working on it. They are looking for treatments. And when it comes, inshallah, everybody will come to know that which drug is effective. But again, I will say that hydrochloroquine is not approved drug for the treatment or for the prevention of COVID-19 till date. I hope that this answer satisfies your question. If you have any more questions, you can type here. It is my pleasure to answer you any of your questions. Well, so okay, I will look on. Is there any more questions? Well, there is a question from Mr. Shibu Thomas. More number of infections or deaths are reporting from Europe and USA. Any particular reason for this? Actually, yeah, CDC and all over the scientists and doctors are trying their best day and night to see the reason for more infections and deaths. You report from the Europe and USA. Actually, in USA, in the past few weeks, it has been seen that it is spreading very fast. And I think they are doing the tests also. The testing in USA, Germany, Italy, Spain, in these countries, they are testing the more people. They are testing even those people who have no symptoms. And it depends upon the testing. Okay, each country, how many tests are done per million population, it will show the positive. As I said that COVID-19 can be in asymptomatic people also. They cannot show any symptoms, but still they have this disease. So this is the reason maybe that it has been seen more in Europe, that they are doing more testing, followed by those countries who follow more testing. As I saw in recent research that in America, in USA and UK and these Germany, Italy, they are doing more testing per million population. And it depends upon the curve of the disease, how it is behaving. And it has like 4 stages: stage 1, stage 2, stage 3, and stage 4. Stage 1 is the stage when this disease comes from the outer source, from when a person travels from other place and enters into a community which has no COVID before. It is stage 1. When this person is diagnosed that he traveled from outside, he came in the country or some place, it is stage 1. When this disease spreads from this person to his close contacts, to his families or friends whom he had a contact, it is known as stage 2. Then when this disease spreads to those people who this person doesn't remember or doesn't know that he had contact with these people, this is known as stage 3, when the person is diagnosed and he doesn't know any source. In stage 2, we know the source, that their relative or his brother or mother or sister came from outside. He lived with him together. It is known as stage 2, that they got infected from this person. In stage 3, they don't know what is the source. And in stage 4, when the disease spreads rapidly to all the population, and I think in Europe it is now almost stage 4, when you don't know the source, when you don't know how it is spreading, and it is spreading very fast. Any more questions? If anybody having any more questions, please, you can post your questions. I am ready here to answer. Mr. Abu Shibu Thomas, thank you, doctor, for the detailed answer. Okay, it's my pleasure, dear. If you have any more questions, I would like to explain, and I would like to, what knowledge I have, I would like to explain it, please. You are welcome, dear. You are welcome, Mr. Shiv. I would like to remember you that there will be one more session for those people who speak and understand Arabic in the coming days. It will be in the Arabic. And once more, I will repeat that there has been 2 sessions of the same topic in 2 different languages by different physicians of Dhaman Center. So you can watch them in Hindi and Malayalam on Dhaman Live YouTube channel. You can just type Dhaman Live in YouTube and you can find these sessions in Hindi and Malayalam for those people who understand and speak Hindi and Malayalam. Today we had an English session and next will be our Arabic session. Dhaman Center is trying their best. They are creating this platform because we have a community here in Kuwait. We are living together from different communities, from different places. So a multilingual approach, which Dhaman understood that it is important so that the message reaches to everyone. So we are trying our best to convey the message to the general people, how we can stay safe, how we can prevent the spread of the diseases, how we can, how we can save our families, save ourselves, and save the nation of Kuwait. Well, I think there are no more questions right now. Okay. So at the end, it was a nice talk today, and I hope everybody understood the message. Oh, there are some more questions. Mr. Adnan Tariq, thank you, doctor. It was a very nice. Okay, thank you. Well, there is Mr. Basil. Is it true that BCG vaccine given to infants is protective children from getting COVID? Okay, it is a controversial answer. I cannot answer it. No, there are studies going on, research are going on, whether the people who have got BCG vaccine, whether they are more immune, whether they are more, they are at less chance of getting COVID-19. But till now, it has not been proved. I can understand because on social media, there are a lot of debates, even on TV channels. You can see that. Even I myself watched before a couple of days, there was a debate on BCG vaccine. But till now, it has not been proved that who has got the BCG vaccine, that he has the protection from COVID-19. So again, I will say that please stay home, stay safe, don't go outside, and maintain hygiene around you. Don't throw used tissue papers, don't throw used masks, don't throw used gloves around your community, around yourself. Now, Mr. Athar Kudus is asking, in Kuwait, in which stage we are? Okay, well, so exactly 100% I cannot say in which stage we are, but we have crossed the stage 1 and stage 2. Now we are going in stage 3 because in recent days there has been some cases. We cannot say we are fully in stage 3. In stage 2, as I said, that these are the people who get in contact with those people, those cases who get in contact with those people. It is stage 2. Stage 3 is when the person is diagnosed and he doesn't know from where he got infected. He went outside maybe to the grocery shop and he went for a meeting, he went to somewhere and he doesn't know where from he got the infection. So most probably we are in between stage 2 and stage 3. Hopefully that by following these measures like staying home, hand hygiene, wearing masks properly, and keeping distance, social distancing, and I hope that we can prevent ourselves, our families from spreading this disease. There are some more questions here. Mr. Narayan, how can we wash fruits and vegetables when we bring from Jamia? Well, dear, when you bring the fruits and vegetables, it is just as usual. No need to wash them in any specific solution. No need to wash them in any. I have heard from people that they are washing their vegetables with the Dettol and all that. Usually, there are fruits which can be peeled, like apple, banana, and other fruits which can be peeled. You can just wash your fruits in a warm water as usual. It is a routine for us that when we buy the fruits or vegetables from outside, sure, we wash them in the warm, lukewarm water. And it is the same thing that you can wash these fruits and vegetables in the lukewarm water. And moreover, when vegetables are cooked or meat is cooked, and chicken or mutton, whatever it is, if it is cooked, so it is free from the viruses. It will not sustain in those 100 degrees when we boil the food. But for fruits, you can just wash them regularly with your water. That's all. No need for washing it in the special solutions or anything. But again and again, the things which you touch every day, like keys, wallet, your money, wash your hands regularly, and if possible, just try to desanitize your keys, your wallet, which you use very often, your cards and all that. You can just rub with the alcohol solution. Mr. Sodal Bassam, hello, Dr. Tariq. Is it true that a recovered patient from COVID-19 can't get infected again? Very good question, from Mr. Sood Bassam. Well, it has been seen that there is till now there is no evidence that people who got infected and got recovered from COVID-19 that they are immune from getting this disease again. There is no evidence till now that we can say that a person who got infected from COVID-19 and recovered from the COVID-19 that he has a stamp of guarantee that he will not get it again. No, it has not been proved now till now. Okay, well, there is a question from Mr. Shibu Thomas. Is there any chance to get infection through air? No, till now, as I said, that this infection is spread through mucous membranes. Mucous membranes means through mouth, nose, and eyes. So from air, our ears are protected by a tympanic membrane, that there is no direct connection with our mucous membranes inside our body. It cannot go through the air and enter in our body. So till now, it is not. It cannot enter from our skin. It cannot enter from our body surface. It can enter only through the nose, mouth, and eyes. So that's why I'm again and again telling, avoid touching your mouth, nose, and eyes, because a person intentionally very often touches their nose, mouth, and eyes. And I will repeat again for those people, please, who wear masks. I have seen today, every time when I go out, I go very, very, very less. I go out if it is like very urgent for me. And I have found people masks on their foreheads, masks on their hanging on their neck, and then every time they are pulling them up and down, which is very wrong. Please don't do this, because you are putting yourself at risk. When you hold a mask and pull it up, your hands gets contaminated from the outer surface of the mask, which you had put before on your nose. So if you are without mask, you are at less risk than putting a mask and pulling it up and down, pulling it from head to nose, nose to neck, neck to head, because your hands are the most contaminated part of your body. As I said, that the virus stays on the surfaces. So when you touch the surface, your hands get contaminated. So avoid touching your hands, nose, and eyes, and don't manipulate your mask. Once you wear the mask, wear it, use it, then remove it from the back of the ear without touching the outer surface, throw it in the dustbin, and wash your hands again. There are few more questions here. Miss Rose, Chris, whether temperature change will make any change in COVID-19 spreading? I think I have answered this question before, but I will repeat again. Sorry, there is no relation between temperature and spreading of COVID-19. There is no relation till now. It has not been proved by the scientists or any authorities or WHO or CDC that there is any relation in temperature, that if temperature, rise in temperature can kill the virus. As we know that our body temperature is 37. If it would have been like that, then the virus would not have been survived inside our body where the temperature is 37. So there are some in social media you can find a lot of messages that it is that in summer the spread will stop and all. No, sorry to say that it has not been proved till date that there is any relation between the temperature and the spread of COVID-19. So I think many people have joined late, so I will again repeat few points about concluding my talk. I will repeat few important points about today's talk, that because I see that many people have joined recently, so for them I will just conclude. I will just summarize today's talk that COVID-19, it is a new virus. It is known as a novel coronavirus, which means novel means it is a new virus. It had not been seen in humans before. So it is spreading from person to person by means of air droplet infections. By means of air droplets, spreads from person to person. While patient is infected, when he coughs, the air droplets can reach up to the distance of 2 meters and can stay on surfaces around you. And when you touch these surfaces, either it is a table, it is a handle, it is a knob, it is a lift button, or it is a trolley or anything, when you touch them, your hands become contaminated. And unintentionally, when you take your hands towards your mouth, because a person cannot hold his hands 24 hours, unintentionally or intentionally, you take and touch your hands with your nose, with your mouth, with your eyes. And in this way, the virus gets inside your body and starts replicating, starts multiplying. And within 2 to 14 days, and an average of 5 days, a person gets symptoms. It can be mild, moderate, and severe. There are some more questions. Okay, Mr. Nabiullah said, he's asking, since the symptoms of COVID-19 are almost common with other illnesses, how could we make sure that we are infected with unless tested? Well, as I said in my talk previously, that in these days, if anyone having even normal flu, we cannot differentiate. There is no clear differentiation between the symptoms of normal flu, influenza, or COVID-19. If you have dry cough or even cough, severe cough with fever, shortness of breath, and severe body aches, if you have these symptoms, you should call 151 and talk to them, or you should call your doctor and discuss with him what symptoms you have, since how many days you are feeling you have these symptoms, you have this fever and all that. Accordingly, they will advise you what to do further, whether to go for testing or whether to go not. Because the history, it depends upon patient to patient. His history, maybe a person is suffering from tonsillitis. He has a known case of tonsillitis. He has fever and sore throat. Then after checking, they can say that, yes, it is because of tonsillitis. Some people have chronic sinusitis. These patients can have fever and nasal pain, but without cough. So by listening to the history, we can come to the conclusion to some point that this is sinusitis. This is not like, viral infection. It is a bacterial infection. Some patients who have pain in the ear, they have otitis media, they have also fever. They have also body aches. But with the history, when we take the history, that whether you have this, since how many days, we can come to the conclusion it's a viral infection. But if it is a viral infection, we have to call our doctor to be sure that it is not COVID-19. Well, there is a question from Mr. Basil. Hi, doctor. Would you recommend to use masks and gloves all the time we go outside, or just health workers and patients to use it? As an advice, it is advisable to use healthcare professionals to use the masks all the time. And there are different types of masks, and 95 and surgical masks. And 95 masks are basically used for healthcare professionals who are taking care of COVID-19 patients, positive patients. And your question is just as you should use the masks. As I said that recently it was seen that the virus can spread from a person who doesn't show any symptoms. In stage 3, when we have people who are infected and we don't know now who is infected. So there is a chance of getting an infection from a person who is infected but he has no symptoms and we don't know who is that. That's the reason we are again and again saying maintain distancing, stay home, don't go outside unnecessarily. The government, the Ministry of Health, other authorities are trying their best day and night to just stop the spread of this disease. So my advice will be, if you have a mask, use it, and after using it, just dispose it off. It is not compulsory, but if you have a surgical mask, if you have a mask, you will be at safer side, and maintain the distance of at least 2 meters, 6 feet from a person when you are staying in a queue, and don't touch unnecessarily surfaces, and don't put your hands near your nose, mouth, and eyes. Regularly wash your hands and sanitize your hands and thoroughly and clean your hands. Mr. Nabila said, how long it is safe to use a surgical mask, can be used or not? Well, a surgical mask, a simple surgical mask, it is a mask which has 2-3 layers. It has an outer layer, blue layer, and inside white layer, and there is a filter in between. Okay, this filter protects us to, actually we cannot, if you blow the air from outside, from inside out, the air will not go from inside out in this surgical mask, simple surgical mask. But when you inhale, the filter, it takes the air and filters all the, which are in the air. We have a lot of bacteria, viruses around everywhere. Not COVID, other common viruses and the dust particles and other things. It usually, with this filter, these all, when you wear the mask, when you breathe, ideally from the outer side of the mask, all these particles stay on that filter, which is the inside this blue sheet, blue part of the mask. So it is advisable, to throw the surgical mask once you use for for maybe 1 hour, 2 hours, 3 hours, 4 hours, 5 hours. But once you use it at the end of the day, it is advisable to dispose of the disposable mask. It is known as a disposable surgical mask. To dispose it off, you cannot wash it because there is a filter, so it will be of no use. But as we know that now we cannot get surgical masks, a lot of surgical masks, it is advisable for other people to use there are some simple types of masks which are, which can be made. There are people who are making at home like 3 layers of cloth or something. It is better than nothing, but it is not as protective as surgical mask or N95 or other kind of masks. So it is better if you use gloves and masks, because you are going and touching the trolleys and doors and knobs and everything. So if you wear gloves, if you have disposable gloves, if you go out, if you have necessity to go out, you can just come back and remove these gloves, put in the dustbin, disposable gloves. Mr. Sanat, how can we build self-immunity? What kind of foods give natural immunity? Taking vitamin C every day good during this time? Well, I have answered the same question before, but I will answer it again. As I said that if we follow a healthy lifestyle, like regularly exercise 30 minutes a day, and washing our hands, staying home, keeping distance from others, and drinking a lot of fluids. If we are smoking, rest from smoking, try to quit smoking, and drinking tea with lemon, eating fresh vegetables, fruits. These are the things which boost your immunity. Even every time we say our patient use fresh fruits and vegetables. This is the main source of vitamins. No need to take extra vitamins. No need to take extra. There are on social media on a lot of things that people recommend these tablets, vitamin tablets. It is not recommended. It is not recommended to take any medical, medications to boost your immunity. Just fresh fruits, vegetables, and healthy lifestyle. Regular exercise, exercise daily, and that's all. How you will say now that doctor, we are staying at home. How can do we exercise now? It is very simple. You can do exercise at home in a room. Just open your YouTube, you will find thousands of exercise for half an hour. Or you can just walk in your hall for 30 minutes, and you can do yoga at home. There are a lot of exercises which you can do at home. There is a question from Mr. Rose. Plasma recovered from person completely cured from coronavirus be used for corona-19 infected patients? This question actually, there might be studies going on. There are studies, scientists and doctors all over the world are working on it, whether the people who have recovered from corona, whether they are immune, whether vaccines can be produced, whether so till now there is no evidence that plasma recovered from people completely cured can be given to the infected COVID-19 patients. There is no solid evidence from any reliable source. There might be, you might have read on the internet from some sources, there are a lot of informations which are not proper informations, but till now we have not received any information about this, that plasma from a recovered person can be given to a infected patient of COVID. Mr. Azim has a question. Any idea how long this COVID-19 subsides? You mean, I think your question is that how long, if a patient will get infected, how fast he can get recovered? It depends upon the severity of the disease. As I said, in the mild form of disease, if a person is infected, he can get well without knowing that he had COVID-19. And in moderate type, he might have to go to the hospital. And in the severe form of disease, he might have to stay in the hospital for long, for weeks, for maybe months. If he is old, if he has other chronic disease, if he has some other comorbidities, some other disease, he might have to stay for long and to recover from this disease. Because for those people who have low immunity, who are aged more than 60, and who have other chronic diseases, they might get the severe form of disease and get complications from disease. So they might need more time to get rid of this disease. But most commonly, if anybody getting the mild form of this disease, they will get recovered within 10 to 15 days and they will be as normal. Well, I think most of the questions I have answered. I hope that you have got the answer to your doubts and you have got the answer to your questions. And I hope that everybody now is aware that what is COVID-19. It is a new virus, novel coronavirus. So there is one more question. So last question, I will take it. Hi, doctor. Even after taking proper precautions, many frontline healthcare professionals and doctors are getting COVID. It is because it may be airborne. Yeah, good question. Actually, many doctors have got infected while taking care of the patients of COVID. Precautions means they are wearing PPE, they are taking all the precautions, but it is not always and guaranteed that a person can 100% take care of PPE while wearing PPE, taking care of the patients. There might be some mistakes in using PPE, in disposing of PPE. There are a lot of things while using this PPE. Even PPE means the proper personal protective equipment. When we use the personal protective equipment, the healthcare workers should know and how to use it and how to dispose it properly. Maybe some mistakes somehow on the surface or anywhere maybe they are getting it, on the when they are not wearing the PPE outside the hospital setup. And it has been seen, there are cases, but it has not been proved till now. Your question is that is it airborne? But till now, it has not been proved that it is an airborne infection. We have no information from WHO or CDC or FDA that, or any scientists or researchers have not proved yet that it is an airborne infection. Till now, it is an air droplet infection. So while using, there is one more question. Sir, is it normal mask can be used once again? Normal mask, I didn't, actually there is, normal mask means the masks which are made of fabric. Actually, I said that the surgical mask and 9-type, they are different masks, and masks which are sold like fabric masks made of multiple layers. And if they have not proper, I don't know whether they have filters which are in surgical masks and all. But if you are going out using you are not a healthcare professional, you are not dealing with the patients. If you are going out, if you have a need to go out, if it is a necessity, if you are going out using a mask, that cloth mask, fabric mask, you can use it. You can use it and then remove it. And most probably, if you use it again, I will not advise to use a mask again. But if you have not enough masks, you can probably use it. But you should have a properly to remove it and fold it from the outer side so that the outer side doesn't touch the inside. If it has some sort of filter, this mask, when you remove the mask, if you have an intention to use it again, so then you can do one thing, removing it properly without touching from the outer surface or the inner surface, and folding it in the way so that the outer surface doesn't touch the inner surface. Because if you do so, the outer surface is contaminated. It has catched some dust and maybe viruses. It will touch the inside. When next time you will wear the same mask, so you are putting yourself at risk by putting the mask which is already contaminated from the outer surface. So better is not to use the masks again and again. And if it is a like cloth mask, fabric mask, I have no idea from which material they are made. If they are made from a simple material, they can be washed and used again. But if there is a filter, so it cannot be washed if it is a filtered mask, if there is a filter inside the mask. Mrs. Rose Chris, what will be the recovery rate if a person with allergic asthma gets COVID? Well, as I said that it depends upon the immunity of the person, age of the person, and other comorbidities. Asthma patient, if he is an allergic asthma, and if anyone who has allergic asthma and gets a COVID, it's not guaranteed that he will get a critical form of disease. He is more prone to the disease. Yes, of course, he has more chance to get the moderate form of disease, but it is not always that he will not get recovered of this disease. It again depends upon the age, upon the severity of his asthma, upon his lungs, upon his treatment, upon his immunity, and age. As I said, above age of 60, uncontrolled asthma. In the beginning, I said uncontrolled asthma. So don't be panic. All the asthma patients, you have to take more care, but don't be panic that every asthmatic patient will have problems if they get COVID-19 and they will not recover from it. So please just relax and look for your health symptoms. Take your treatment regularly. If any symptoms like fever, cough, or shortness of breath, call your doctor immediately for the health checkup. So I will conclude with this. I hope that I have answered most of the questions here. And I will apologize if I have not answered any questions. So in the next session, there will be an Arabic session coming maybe tomorrow or day after tomorrow. And for those people who speak and understand Arabic, they can follow us tomorrow at the Dhaman Live YouTube channel. Thank you very much. Thank you, Mr. Nabila. Okay, thank you, sir. Thank you. Thank you, Mr. Nabila. So I hope that everybody understood now, and the message, the last message which I want to give to all my friends, all the residents and citizens of Kuwait, please stay home, stay safe, wash your hands regularly with soap, and use alcohol based sanitizers if you have regularly. If you touch any surfaces, wash your hands regularly and stay away at least 2 meters from other people. Don't go outside unnecessarily. If it is necessary to go outside, please do so, but don't go outside necessarily. Maintain social distancing. Thank you. It was my pleasure to be with you today. And I would appreciate Dhaman team and Dhaman Center for giving me a chance to be on live today on Dhaman Live to convey the message to all my friends, to all my colleagues, to all my neighbors, to all the residents of Kuwait, to give a message. So I will conclude with that. Thank you, everyone. Thank you. Bye bye.